Hi, this is Dr. Ryane Englar. I am an assistant professor and clinical education coordinator at Kansas State University. Today I'm going to discuss with you the communication tool called asking permission. As veterinarians, we often take on the role of being the expert in charge. Clients pay for our consultation time and our evidence-based opinion on how to provide and more effectively manage patient care. However, there are times when it is both appropriate and respectful to ask permission from our client to either share our insight or to perform a procedure on the patient. Asking permission from a client means exactly what it says. Asking a client if it is okay to proceed. Asking permission statements often start with, "May I?" For example, "May I borrow Brandon for a moment so that we can get started on drawing the blood for those laboratory tests?" "May I shave the fur around the wound so that it is easier for us to keep it clean while it is healing?" "May I trim his toenails when he is in the back treatment area with my technicians?" Let's take a look at how this might work in practice. You are an associate veterinarian in clinical practice. Your client, Mr. Smith, has recently adopted a beagle named Frank. Finances are tight. He is here today to get vaccinations updated, but is concerned about additional expenses that he might incur while at the veterinary clinic today. You need to draw blood from Frank for a heartworm test, but you feel that it would go more smoothly if you were able to take Frank away from his owner. This is Mr. Smith's first dog. He's not familiar with how your clinic operates. Let's take a look at this from the client's perspective if you don't ask for permission to take Frank to the treatment area.
Okay, Mr. Smith, great news. Everything checks out with Frank. He just needs his heartworm test, so I'm going to take him and we'll be on our way, and then we'll see you out the door in about 2 minutes.
From the client's perspective, particularly if this is a new experience for him or her, the client may not know what that means. Is he supposed to wait for you in the examination room? Is he supposed to follow you? Where is Frank going? Why can't Frank stay here? Asking for permission would have more respectfully transitioned the visit from the consultation to the next step of diagnostic testing. Asking for permission would have clarified for the owner what this next step entails. Let's try the same scenario again, this time asking for permission.
Okay, great news, Mr. Smith. Frank did wonderful in his exam today. All he needs is a heartworm test.
Okay.
So I need to draw a couple drops of blood. Would it be okay with you if I took him into the back room to get that started?
Sure, that'd be no problem.
That would be great. Frank, come on now.
Yeah, Frank.
Great job, boy.
Yeah, boy. Yeah, boy.
Note how much more smoothly this transition went. Mr. Smith feels respected because he was asked before the dog was taken from him. Mr. Smith also knows what to expect. Frank will have his blood drawn and will then return to his side to wait for the results. If we ask for permission, most owners will say yes. However, if we ask for permission, we have to be prepared with a plan B if the owner says no. For example, what if Mr. Smith does not want his dog to go to the back treatment room? What could we do instead? You will want to have a couple of options in mind so that you are prepared if and when a client says no.
Okay, great news, Mr. Smith. Frank checked out wonderfully on his exam today. So all we need to do is draw 3 drops of blood for a heartworm test.
Okay.
To do that, I'm going to need to take some blood. Would it be okay if I took him into the back room for our technicians to get started on that?
He's pretty dog aggressive. Can't we do it right here?
Oh, absolutely. I had no idea. That's not a problem. Now, would you like to be present for that, or would you like to step out?
I sure would.
Okay.
That'd be good.
Not a problem. Then you just hang out with him right here, and I'll have the technician come in a couple minutes.
All right.
Great.
In the scenario above, a few variations on how to ask for permission were given. Instead of "May I?", the clinician asked, "Would it be okay if?" and "Would that work?" These questions also achieve the same communication purpose, to ask the client for permission to proceed. Asking permission is especially important in these situations. 1. When there is a fee associated with a procedure. 2. When the patient is a show dog or cat. 3. When the procedure could cause harm. If there is a fee associated with a procedure, then clients have a right to know. For example, a toenail trim that is not complimentary. The clinician owes it to the client to ask, "Would you like us to trim Frank's nails while he is in the treatment area? It costs $15, but would save you from having to trim them at home. I know how much he loves that." The client will not appreciate not being asked and being hit with an unexpected bill.
If the pet is a show dog or cat, it is especially important to ask for permission before shaving any fur. There are situations in which we absolutely have to shave fur in order to provide gold standard care. For example, when we are placing intravenous catheters. But if you shave a show dog or cat's limb without asking for permission first, your client is not likely to look favorably upon your actions. It would be better for you to prepare the client by saying the following. If we place an IV catheter, then we are going to have to shave Felicia's front leg. I know that she has a prized coat, but it is really the only way to rehydrate her. Are you okay with that? If the procedure that you are going to perform has the potential to cause harm to your patient, then you ethically should ask for permission to proceed. For instance, something as benign as a toenail trim could lead to a bloody foot or even transient lameness, as from trimming nails too short. If you do not ask the client for permission, and then the patient returns from the treatment area with a bloodied foot, then there is a problem. If you do not ask the client for permission, and then the patient comes back to the room with an altered gait, that too is a problem. It would be better for you to ask the client for permission first. Would it be okay if we trimmed her nails today? It is true that the patient could still be injured in the process, but then you have at least given the client the opportunity to say no before you got started on something that the client may not have wanted done in the first place. Asking for permission is a communication skill that demonstrates respect for your client. Asking for permission demonstrates that you are deferring to your client and that you recognize the client's right to approve or refuse patient care. Clients appreciate the opportunity to weigh in on decision-making, and this is one opportunity that allows them to do just that. Consider using this tool strategically so that clients feel respected as pet owners.
Thank you so much for watching the U.S.-China Center for Animal Health video, Asking for Permission. For further information or questions, please feel free to contact us at the information provided on the screen.